When you have poor sleep, it can exacerbate symptoms of anxiety and depression, and you're feeling fatigued and irritable, and you're just no fun to be around. You're not even fun to be around yourself. I think we all know what that means. This is not unusual, where people who are in states of chronic stress may turn to substances like alcohol or drugs to cope because they're really finding it tough. Taking substances seems like a quick way to soothe those feelings of distress. But that can lead to substance use disorders, and that can further complicate mental health issues as well. Hello, everyone. Welcome back to Travel Light. It's your friend, Dr. Unoma. To my new friends here, I am Unoma. I am a psychiatrist based in sunny Glasgow, Scotland. And more importantly, guys, I am a Jesus girl. I am a lover and follower of the King himself. And I just love how much he loves us. And I know that this care extends to our hearts. Jesus, he's deeply invested in our prosperity and wants us to thrive in the area of our emotions, in our thoughts, in our passions, and our heart altogether. So here at Travel Light, we are exploring mental and emotional health through the eyes of the Good Shepherd, Jesus. We're on a journey exploring what it looks like to give access to the Lord in this space. So again, you're so welcome back to Travel Light. And can I just ask you to just take a moment, if you haven't yet, to subscribe to this channel. It's a button away, so just do it right now as I'm looking at you on the camera. And if you know anybody who would benefit from hearing what we have to say here on the channel, could you just share? Because sharing is caring and all that. So yeah, share away and let everyone else benefit and join in the conversation. So we're going to just jump right into it. Hope you guys are ready to go. As you know, we've been talking a lot about stress and mental health. And I was thinking the other day that whenever I tell people that I have started a podcast about mental health, there is this automatic assumption that I come across where people automatically think I am talking about mental illness. And this is not necessarily the case. So if I say to someone, I started a podcast about physical health, there would be an understanding, I hope, that I was talking about maybe being able to eat well, sleeping well, exercising, doing your strength training, things like that. So ways to improve your physical health, your physical condition, so that if you were ever faced with an illness, you would have a fighting chance, one, and in fact, maybe even prevent illnesses from happening. So when I say mental health here, I am primarily talking about that. I am looking at ways to bolster our mental health, to bolster our emotional health, to build resilience so that when life happens and throws curveballs at you, it means that you're able to thrive in the midst of adversity. That is what Travel Light is about. Now, don't get me wrong, we're going to have conversations about mental illness. We are going to talk about that because it is super important, okay? We need to know what it looks like when we have decompensated and not doing well so we can look for help, right? But primarily, we are talking about mental health, but our focus is about building that resilience. So it would be mad if I didn't talk about stress, because stress can have really profound impact on our mental health. So I thought it would be a good idea to dedicate one episode to the impact of stress on mental health specifically. I am a psychiatrist after all, so just get strapped in and we're going to travel light together, okay? So now, as a clinician, so as a psychiatrist, working with people with mental health, and see I did that there, with mental illness, whenever I review my patients, I regularly ask questions to investigate potential areas of stress. So I will ask questions about personal relationships, how they get on with their friends, have they been in any conflicts recently, how are they getting on with their family dynamics, how are they getting on with that family member that doesn't quite understand what they're going through and putting pressure on them. Do they have any financial worries? Are there benefits coming in on time? Are they in any debt in any way? Do they have any physical health concerns? Even things as minor as a cold or having had a chest infection that has lasted longer than we anticipated. Or they have this back pain that is unrelenting, as they're gnawing at them every day. Or do they have any sick family members? So a mom who maybe fractured her hip and is stuck in hospital and doesn't have any exit strategy because they don't have any home help yet. Or they have a father who has maybe had a heart attack recently and they're the patient, are stuck in hospital and can't visit the family member. I'm asking about this because we know that stress is a well-documented risk factor for, one, the development of mental disorders. So things like depression, anxiety, post-traumatic stress disorder. And for people who do have these mental disorders, stress can make those symptoms even worse. So for example, if a patient came to hospital having had a relapse of a bipolar illness, I would be asking, has there been any recent traumatic or stressful event? And again, it doesn't have to be something major. It could be something minor that has maybe built up over time, has then tipped them over the edge. Or if someone had a schizophrenic illness, I would be wondering if they had worsening psychotic symptoms. Has there been anything recently that has maybe added more pressure to them that has made the symptoms worse? And for people who do have mental illnesses, gone are the days when if someone had a mental illness, we would, send them to an asylum where they would live out there the rest of their days, kind of working away and just what were we thinking? Anyway, that's what we knew back then, right? But now the focus now is having people live in the community, and we want to empower people who do have a mental illness with all the skills that they need to thrive in the community. Now, if you have stress or ongoing stressors, even with the best of skills, stress can actually impact on your ability to deal with the day-to-day things that I would take for granted. So being able to budget, pay my bills on time, being able to self-care, being able to maintain employment. So stress can have a profound impact on these things as well. And for people, again, with mental illnesses already, stress can affect the course. So basically the way the illness behaves over time. I'll give you an example. So there are some illnesses like schizophrenia or bipolar affective disorder where you might find that people might go into a remission for a period. And when maybe there is a stressor, they can then have a recurrence of symptoms again. So relapsing and remitting. And if there is chronic stress, these relapses can become more frequent and potentially more severe. And for some people, if there is ongoing stress that just doesn't go away, these symptoms can persist longer time. And the unfortunate thing is that when people have symptoms for a long period of time, it can really affect the prognosis, meaning the eventual outcome of said individual with mental illness. So stress is super important when I consider my patients and how they will fare eventually. And also when I'm thinking about the care and treatment plans. So I thought it'd be really important that we had this conversation because the relationship is actually is really important. Now, people will often ask me, how do mental illnesses come about? Where do they come from? And you might be maybe struggling with one yourself or coping with one. And you probably wondered, where does the illness come from? And you probably asked that question. Now, it may sound like a cop-out. The answer is it's really complex. And thankfully, because of research, we know a lot more than we did, say, 50, 100 years ago. But one thing that we have seen, in observations, in clinical practice, and in research is that there is a clear, intricate relationship. Did I say clear, intricate? There is an intricate relationship between stress and mental illness. Now, certainly when I was training, I learned about this very interesting hypothesis. It's called the stress vulnerability hypothesis. Now, in the 70s, these two psychologists came up with this model where it looked at stress and its relationship with vulnerabilities. And I explain. Now, most people will have vulnerabilities to mental illness, right? Now, it could look like, say, a family history of mental illness. So, for example, somebody like my mom or dad having schizophrenia. For some people, it might be having really difficult early life experiences. For some people, it could be potentially maladaptive personality traits. I'm speaking my medicalese here, but maybe personality traits that don't help with managing pressure when it happens. And for some people, it might be some temperamental attributes that are not quite positive. Early life experiences is another one, as already mentioned. Brain structure is another one. So these are factors that you can't quite change. You don't quite have control over per se. So these will be your vulnerability factors. And then you have stress, which, life happens and there's some things you just can't control. So God forbid you were involved in a road traffic accident, which you had no control over. You were just sitting in your lane and someone then came and hit you from the side. And that was a traumatic experience for you. Yeah, that would be your stressors. Now, to a big degree, we can determine how we cope with stress when it happens, which is why we're having this conversation, right? So I want you to imagine this. So imagine a bucket. So a bucket that has water in it. And on the side of a bucket, there is a tap that, depending on how, to the degree you open the tap, it can let out big amounts of water or small amounts of water. You put that bucket outside and rain is pouring into this bucket. Okay. If you don't open that tap, as the rain pours into this bucket, eventually it's going to overflow, isn't it? Yes. Now, consider a different scenario. Say there is rain and you put the bucket out into the rain, and you have opened the tap maybe fully or halfway or whatever, but water is still kind of leaking to the side as water is coming in or coming down from above from the clouds. So there is less likelihood in that second scenario for the buckets to become overflowed. So it's a bit like that with mental illness and this hypothesis. Now, I will say that this has its limitations, so it doesn't explain everything, but it's a helpful way to think about how stress can impact your mental health and then eventually lead to mental illness. I hope you're with me. So think about the bucket being your vulnerability. So things you can't control, the size of your bucket you can't really control. So the family you came into, you didn't really have much to say over, did you? Yeah, mommy and daddy, stuck with them, as they say, like them or lump it, whatever. You know the expression. So you can't really change where you came from. You can't really change your genetic load. You can't really change the experiences you had as a child. So these are your vulnerability factors. But what you can control is how much you can let out the pressure that life can put on you, right? So that would be the way you cope. So if you have good coping skills, it means that your tap is working and you're letting that stress out, you're letting that pressure out really well. But if you're not coping, your tap isn't working and the water fills up and eventually it will overflow. And that's when you decompensate and you may develop a mental illness. It's a very simplistic way of looking at it, but I hope it's a helpful way to picture what that looks like. So you may not be able to control the size of a bucket, but you can control how well you let out the water that builds up in the bucket. So that's the relationship between stress and your vulnerability factors. So give you an example. So think about Amy. So Amy is a lovely girl living in south side of Glasgow, living in wherever. She has a father and a paternal aunt who has schizophrenia. So there's that genetic risk of developing schizophrenia. And, she had a little bit of something going on when she was a child. Nothing too bad. And she's been kind of coping relatively well and doing what she kind of needs to do. But she gets into, 6th year of high school, and then the exams are really stressful and, she can't really cope anymore. And life is just happening, and that tap isn't open to a good level so that the pressure is at least been released slowly. And unfortunately, she develops some psychotic symptoms, in the last year of high school. So now that's kind of a really bad example, but I will give you more examples as we go on in this episode. So people with a higher level of vulnerability will be more likely to develop a mental health condition or mental disorder when exposed to stress. So again, you can't change very much about what you were born with, but you can change the way you respond when life does happen and throws these curveballs at you. So now, even though I have said that model is a little bit simplistic and does have its limitations and criticisms, I think it really is helpful. And certainly in research, we do have enough evidence to back up that hypothesis. Certainly, studies indicate that a loss of a loved one would significantly increase the risk of developing a major depressive episode. And say having childhood trauma would likely increase your risk of developing, say, PTSD in the future or anxiety disorder. And I have mentioned that in practice, people with a bipolar disorder, if they had a relapse of a manic episode or a depressive episode, very likely there would have been a stressful incident or stressful conditions that came before that relapse. And similar with schizophrenia, people who have a relapse of psychotic symptoms would often have had something stressful or stressful life events that have happened prior to that. So once again, you may not necessarily be able to change your genetic load or your family history, but to a reasonable degree, you can work on building resilience to stress, and you can also minimize the impact of chronic stress in your life. And in fact, you can even avoid it, because we've now learned, right, that stress really is your body's response to life's pressures, and it should help you to adapt, cope, and thrive to changes in your environment. What we don't want is that ongoing low-grade chronic stress where you're so used to that you're not even aware that it's happening anymore. So let us chat a little bit about mental illnesses in general. So we probably know about the common ones that maybe even you're coping with. So depression, for example, chronic stress is linked with the development of depression and definitely the worsening of depression if you are already diagnosed with that. Anxiety disorders as well. Stress can trigger the onset of anxiety disorders and can worsen their severity. Post-traumatic stress disorder, the clue is in the name, stress disorder. You're required to have gone through a significantly stressful event, something traumatic, to even, meet the criteria for the diagnosis of such a disorder. And the severity and the duration of the stress is often proportional to the intensity and frequency of the symptoms as well. I've mentioned what's the word? It's not ad libitum, whatever that word is. But I have said ad nauseum about how stress can trigger depressive or a manic episode with people with bipolar disorder. And with schizophrenia, stress is thought to play a role in the onset of schizophrenia, especially for those who have a genetic predisposition, and it can also make symptoms worse as well. So, as I mentioned, when I am considering care plans for my patients, I am always thinking about potential areas of stress and ways that I can mitigate the impact of stress in their lives, and also to reduce the adverse effects of stress and hopefully improve the mental health outcomes for my patients. So I have spoken about my little case study, Amy. We'll talk a bit about Maria. So Maria, 28-year-old, who's doing quite well as a marketing executive. And she has some predisposition in that her mother has anxiety and struggles with some anxiety symptoms. And, Maria's been doing all right. Her job's really high pressure. She's working to tight deadlines and long hours. And now she's got a promotion, which means she has to move cities. Same job, but my goodness, that move is stressful. And she now has even much more on her workload. And then all of a sudden, she starts developing, panic attacks. She's worrying a lot, and she's getting physical symptoms like heart palpitations, stomach pains, dry mouth, and difficulty swallowing. And she goes to her GP and she's been told she has an anxiety disorder. So the combination of her genetic predisposition and now this intense work environment, which has been happening anyway, and she's been kind of coping with it, and all of a sudden there's this additional stressor in that she has had to move. She's now got extra responsibilities on her plate, and now she develops an illness. So I hope you're getting that now. So she can change the bucket, but unfortunately she wasn't able to cope with the amount of rain that was pouring in and wasn't letting out that pressure as well as she could, which is everyone. I think we can all relate to that to some extent. Let's think about David. So David is a 24-year-old man. These aren't real people, by the way, just so you know. But David lives in the east end of Glasgow, doesn't come from the most well-off family. Unfortunately, he had experiences where he would watch his mom being beaten up by his dad whilst he was drunk. So quite a few vulnerabilities. He had these issues. He had obviously financial adversity and also watching trauma and being a partaker of that. Then, he didn't finish school, left, in fact, got kicked out because he He got involved in a fight, the stress of it all, didn't have any qualifications, and unfortunately got involved in gang fights, not been able to do any jobs yet. And now he's 23 years old and he's been told his mom's got cancer and she's died. He starts taking drugs to cope with it. In fact, starts taking more drugs because he's been on that anyway. And then 6 months down the line, starts hearing voices and they don't go away. And now he has a diagnosis of schizophrenia. So this is how life happens, you know? And we all have our stuff. We all have our vulnerabilities. We're all carrying different things that, you know, if I were to walk in your shoes, I don't know if I would cope and similarly, I don't know if you cope with my stuff. But we can learn. We can learn how to build resilience. We can learn ways to thrive in the midst of adversity. So, chronic stress, I have mentioned over and over, we do not like. That is the killer. That is the one we want to snuff out. We want to be good with picking it up when it's happening, because I have spoken about how it affects our physical health, but it can have profound effects on your mental health as well. So remember the last episode, I had this chat with you about the HPA axis. I'm going to be a geek again. So it's your hypothalamic pituitary adrenal axis, which gets activated when you are exposed to stress longer term. Now, you release the hormone cortisol, which is actually your friend. But when this system is activated for long periods of time, it means that your cortisol is at high levels for a long period of time, and your body wasn't built to live like that. When this cortisol is there all the time, this hormonal imbalance can then also mess up neurotransmitters. So neurotransmitters are little signals, molecules, compounds that your brain and your nervous system sends to cells in your nervous system to transmit information. So ones you've probably heard about would be serotonin, dopamine. Now, when your hormones are out of whack, then they can also impact your neurotransmitters as well. And these neurotransmitters are really crucial for your mood regulation. So over time, there will be this increased risk of developing mood disorders like depression and anxiety. So you getting low mood when you are stressed chronically is not an accident. That's what's happening because your body is not out of whack, because you are in a state of constant fight or flight, essentially. Similarly, chronic stress can change the structure to your brain. So your prefrontal cortex, that's involved in your decision making and your emotional regulation, and your amygdala, I'm teaching you a lot, right, is involved with fear and stress response. So now when you are exposed to high levels of stress for a long period of time, these changes can basically mess about with your ability to process things. So that will be your cognitive function, your emotional regulation, and these can also lead to an increase in your risk of developing anxiety and post-traumatic stress disorder. There's another really beautiful part of your brain called your hippocampus, which is involved in your memory formation and also in stress regulation as well. When you are exposed to stress for a long period of time, the hormones can also mess about with the size of your hippocampus. That can shrink. A smaller hippocampus can lead to a higher risk of you developing depression, and also can mess about with how your cognitive function is as well. So stress is no small thing. You know, we need to really pay attention to this. In previous episodes, I have spoken ad nauseum, and I remember what that word is, or that phrase is, about chronic stress and how it can impact your immune system. When your immune system is out of whack again, it means that you're more susceptible to infections, and basically you have low-grade inflammation going on. And there is some emerging research that indicates that this can also affect your brain and could potentially contribute to you developing mood disorders and also affect your memory, your cognition. And it goes without saying that when you are in states of chronic stress, you're probably going to be having persistent feelings of worry and anxiety, your heightened state of vigilance, you're more attuned and more sensitive to threats in your environment. All of a sudden, your kid's shoe at the door when you arrive becomes the dog to me. Hope that makes sense, because I don't like dogs. But the point being, things that shouldn't really bother you become even more difficult to manage. And stress can impair your ability to concentrate. I think we can all relate to that. That's happened to me before. Your mind is going 20 miles an hour. You're not even paying attention to that YouTube channel you're watching, or that Netflix show. You can't remember what the storyline was. Can impact your memory, your decision-making abilities. Yeah, it's really not good. And you've probably experienced this as well. So when you are in a state of chronic stress, you find it maybe more difficult to sleep. And when you do sleep, you find that when you wake up, you're not feeling refreshed because it was poor quality sleep. And when you have poor sleep, it can exacerbate symptoms of anxiety and depression as well. And you're feeling fatigued and irritable, and you're just no fun to be around. You're not even fun to be around yourself. I think we all know what that means. And this is not unusual, where people who are in states of chronic stress may turn to substances like alcohol or drugs to cope, because they're really finding it tough. They're finding it tough to open that tap up more so that they can let out that pressure. And taking substances seems like a quick way to soothe those feelings of distress. But that can lead to substance use disorders, and that can further complicate mental health issues as well. So yeah, we really want to get in very quickly. We want to intervene early. Now, as with most things, prevention is way better than cure, and we don't want to wait till the proverbial doo-doo hits the fan, okay? So we want to get in there. We want to identify the things that are making us stressed before they become overwhelming. We want to address it early. We want to be proactive. We want to build systems around us that keep us resilient and keep us thriving, and keep us being able to manage and adapt to challenges and just keep winning in the face of what life throws at us. And the point of this is that our health outcomes are better. We avoid the buckets becoming too full, and prevent the risk of us developing mental health disorders, and just have an overall improvement in your quality of life. You reduce the impact of stress on your relationships, your work performance, and just your ability to function. You are made to live well. You're made to travel light, for goodness sake. So that's what this is all about. So I have been talking a lot about, obviously, the negative impact of stress, etc. And I hope I've scared you enough into taking action. But I recognize that I haven't actually given us tips, and we will go through that. But tips on managing it. I'm going to give you like a laundry list just now. And in future episodes, we are going to delve deeper into them. So learning how to manage stress is really important in, again, reducing the likelihood of developing illness. And if you do have one, you can prevent relapse and improve chances of recovery and having a good quality of life. I've said that a zillion times now. But if we can pick up practices like mindfulness. So mindfulness is a really great way of developing awareness, being able to be in touch with your body, being in touch with your emotions, and being present, staying in the moment. Meditation is another one. Deep breathing techniques is another one. Do you know we really underestimate your breath? Like, God gave us a breath. Like, He is in the breath. And we're going to talk about that because I'm super excited about chatting about that with you guys later. Also, things like identifying stressful triggers. Like, it's okay to know that a relationship is not working for you and it's toxic. And if you can't fix it, it's okay to kind of walk away. If you've prayed and you feel like that's where God is saying, like, actually, I don't think I should be in this anymore because this is not serving me. That's not a bad thing. Figuring out that actually maybe a work environment where it may have been good before, but it's no longer working anymore, and maybe it's time to move on. Maybe Holy Spirit is saying this is no longer where we need to be. Where I'm no longer camped here. We need to move on. That's not a bad thing either. building supportive relationships, like actually investing in relationships that, I hate to say this, but matter. Your family, your spouse, your best friends, things like that are really important. And do you know what? Seeking professional support, you are not weak for doing that. Everybody needs help sometimes. Lean on me. Sorry, I had to do that. But yes, we all need help sometimes. And thank God, the stigma around getting professional help has reduced significantly. I can't go on Facebook without seeing an advert for a counselor online. So you don't even have to meet people in person now. You can meet one on Zoom and you can talk through things that you're really struggling with if you need some support with that. I am an internal processor most of the time, but I have found that discussing issues that I'm finding especially difficult with my mentor is so invaluable, and I really, really benefit from that. Therapy, I've kind of touched on that. Big one. There's so many modalities available now. There's cognitive behavioral therapy, which I've touched on before. Mindfulness is another type of therapy. Psychodynamic therapy is another one. So many. I really like therapy, actually. In theory and in practice. And just good old self-care. Being able to maintain a healthy lifestyle. So being physically active, just a walk, get some vitamin D, for goodness sake, eat well. The ultra processed foods that forms a major part of our diet is not the best for us, and we know that. We want to eat nutritious meals, things that would bolster our bodies and actually help with our hormonal balance as well. And can we not underestimate sleep? Sleep is a major one. Sleep is holy. Sleep is made by God, as a gift given by God to us to enjoy, and so important. I think we often minimize that. So I hope you have found this helpful today. I have gone on for much longer than I thought I would, but if there's nothing else you've taken from this episode, what I want you to remember is that there is a clear link between stress and the development of mental illness. And if you do have an illness, being in situations where you are chronically stressed or facing especially acute stress, very difficult situations, can really impact on symptoms, and it can impact on your ability to function with the symptoms. So it's really important that we are proactive in our management of stress. I've given you some potential stress management strategies, and we will delve into them in later episodes. So this is why you need to subscribe, guys. And again, early intervention is key, guys. We don't want to wait till we are overwhelmed and decompensated and don't know where to turn. And seeking help, guys, is super important. There is nothing wrong with you for asking for therapy or speaking to a friend or speaking to a pastor or speaking to a counselor. It is healthy. It is necessary, especially in our day and age. So before we round up today, I just want to leave you with a thought, a bit of scripture that I felt that would hopefully help us, encourage us to taking proactive steps to managing our bodies, managing our minds. 1 Corinthians 6:19-20 says, I'm going to read from two versions, if that's okay with you. And this is scripture we know very well. So 1 Corinthians 6:19-20, and this is the New King James Version. Or do you not know that your body is the temple of the Holy Spirit who is in you, whom you have from God, and you are not your own? For you were bought at a price. Therefore, glorify God in your body and in your spirit, which are God's. And the Passion Translation says, have you forgotten that your body is now the sacred temple of the Spirit of holiness who lives in you? You don't belong to yourself any longer, for the gift of God, the Holy Spirit, lives inside your sanctuary. You were God's expensive purchase, paid for with tears of blood. So by all means, then, use your body to bring glory to God. Taking care of your body is an act of worship to God. It is you paying homage to the Creator himself and his wonderful work of art every time you do so. And it's not that weird self-love idolatry thing that I sometimes see. No, this is you honoring God by honoring the body that he gave to you. So I want to just encourage you to prioritize self-care, seek support when you need it, and go for it, guys. Be proactive in taking care of you because God cares about you. So thank you again for listening, guys. We're going to continue our conversation about stress in the next episode, if I can get that out of my mouth. And if you have any comments, please, guys, put them down there. I can't wait to hear them. I'm going to respond to them. And till next time, do continue to travel light. See you later. Bye.